Hello, and welcome to my live. A lot of you are gonna watch the replay, so I think I can just start with this. So it's rainy season, and I actually thought to bring this to light so that few of you, especially for the mothers, come very close. Let's have a conversation. So I see habits where people just pull into the water. Sorry to use that word. Do number two into the water. Now it's raining, the water is running, and then it's going to the water source for so a lot of people that don't have the facility to keep their water clean, or probably just sterilized to the level where it's free of microbes. So, but then since we can't really handle a lot of these things, and I know the government are trying to ensure that we bring to you just for your own understanding. I've been on um, emergency preparedness at home for fever when it comes to late night malaria spikes. I've talked about ORS, where you use that to control the level of weakness and dehydration that happens when you're experiencing diarrhea. So I just want us to understand that during rainy season, we are exposed to a lot of things, right? Number one on my list is the fact that, um, yes, people eat from some random places. In fact, you may not even need to fetch the food yourself. You could always send someone to fetch from Mama Ibuka's joints. And we don't know the water that Mama Ibuka is using to make the meal. Let's not forget the veggies, the ugu, the water leaf, any sort of leaf used in making soups. Either they are washed with the water fetched from the river, or she's using that same water to cook without boiling them above a bit up to 100 degrees. And you can agree with me that these things we can't really tell what we are going to do except we try to prevent and control. So please, on no account should anyone do number two. The water is flowing, the floods are everywhere. Please try to avoid that. Number two, I want you to know that this period, malaria outbreak because of stagnant water. So, and we've always known the use of bed nets. How many of you sleep under bed net? Be like say, government go to do their own, you too go to do your own. And let's not forget that the medication to a large extent has been abused by a lot of us. If you're to treat malaria all the time, it's quite unhealthy, especially for children, especially for nursing mothers, pregnant women, elderly ones. I know about certain conditions that are very common during rainy season and how we can really help in a way. So we can't really control people's attitude towards these things, but please let's raise our voices when you see someone having to do number two into the flood, the flowing water. Please tell the person to stop, and then we should ensure that we have the basic vaccines that are required because, like I mentioned earlier, when you eat out, you're predisposed to typhoid fever, you're predisposed to cholera, even hepatitis A, which affects the liver. And a lot of us have not had these vaccines. There are vaccines available, just for your information. And if you know of anyone, especially the children, for the waterborne conditions, we have a lot of vaccines. There's cholera vaccine, there's typhoid vaccine, we have hepatitis A, we have which other one? We have even which other one? I think those are the basic ones for now. If I remember any other one, I'll let you guys know. So aside the waterborne, it comes with some kind of humid uh, infections that are common during the season, rainy season. A typical example is a case of flu. Yes, I know that we all think what is common in Nigeria is just normal cold. Yeah, it's actually flu in a way, and we don't have that which is really prevalent here in 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 a format that makes sense to everybody. But let me tell you for free that for every time you have a flu shot, whether you're taking it as a child or as an adult, it reduces the severity of the actual infection. Peradventure, you come down with it. So for mothers on this platform, it's important for your child to have a flu shot, even if you don't take it. So a flu shot, and then we also have vaccines for pneumonia. A lot of times, children are exposed to cold, and over time, especially for those under 5 years, it's unhealthy. The child can, let me not say what the repercussions are, right? The complications that come with pneumonia, you don't want to know about it. And you keep retaining hospitals from time to time. The medications don't work if you're abusing antibiotics, because obviously that's what happens all the time. So the truth is, when we have rainy season, there are basic things that your child should take. Should take pneumococcal vaccine against pneumonia to prevent and protect them. It's not obviously going to stop the infection. In a way, it will help control the severity. You also want to have this child take a flu shot. I've mentioned that before, and it's every year. Thirdly, there are children that are asthmatic, and you don't want to trigger the episodes with frequent exposure to cold. Hence the need to ensure your child is properly dressed, whether on the bike to school, or inside the bus, or in the house where the AC is turned on and everywhere is humid. So we just want to ensure that you are well armed. And beyond this, I know that a lot of us don't see the need to boost our immunity from time to time. I will encourage you to do that. The use of vitamin C, not as supplement but as fruit, is very key. And please, parents, when you bring your child up in about conditions that are very common in the rainy season, we have the waterborne infections, we have the one caused by vector, which is malaria, and then we're talking about respiratory infections, which are cases of asthma, frequent flu. You're having cold. Cold can be controlled. The severity can be controlled with the flu shot. I've said this over and over again. And I also want to mention, if you do eat out, please ensure you have your hepatitis A to protect your liver. Ensure you have your cholera vaccine, which is very much available. Just ask. And if it's not available, please check the next store. That should be your primary healthcare center or your standard private or teaching hospitals. Now, going back to what we were discussing about pneumococcal vaccine, how about your elderly ones? You know, we have parents 65 years and above, or even those that we obviously know they have they've exposed themselves to cold over and over again and are treating with antibiotics. Pneumonia has been diagnosed severally by the doctor. There is always a need to have a pneumococcal vaccine given to the elderly ones and the children under 5 years. Why? Because you want to control the severity of the symptoms. Hi, Tochoko, you're welcome. Hi, Glory, you're welcome. Welcome. Please, my page is Nurse Otis Flip. Do well to follow. And yeah, we'll be dropping more details there. So I expect us to be abreast with all that it takes to handle the emergencies that comes with all the situations. Malaria will always come down, will give you that fever where you have to run from either paracetamol to anti-malaria. A lot of us don't have time to use bed nets. Neither do we have time to clear the surroundings. Because maybe for some reason, you just feel like, no, it's just one mosquito bite. Trust me, excuse me. A mosquito bite can do a lot of damages, especially to the children, pregnant women, and those that are anemic. And if your immunity is low, the level of malaria severity, I mean, it's going to be so severe to the point where you could come down with anemia. Let's not also forget that for those that are asthmatic, if you have your medications handy, of course, you should have your medication all the time. If your child is asthmatic, let the child have that the inhaler in the school bag, let the child have it handy in the room. Well, if you're buoyant enough, just keep it somewhere accessible to anybody. So if the child is not having you around, he or she knows how to use it. Children are smart. They know a lot of things when you teach them. If you don't teach, they won't know what to do. So you teach the child, number one, the triggers. If the place is dusty, or you feel very cold, or you don't even need to feel very cold, just a little cold can trigger it for some people. So the child should be well dressed, whether he's going to school. A lot of us fly bike for the kids too. Please ensure they are well covered. Sometimes children just feel like it's too much, but no, you know the peculiarity. Even if someone tells you, the weather is not so cold, why are you just bothering yourself with a lot of wears? Please, by all means, do so. You want to pay attention to when the weather is changing and you know what to do. Get your umbrella, get a shed over your head, and please don't expose yourself to cold because it's easier to prevent than to treat. And always have your inhaler handy. Have I talked about everything? One more thing I want us to understand is that whether you're a child, adult, diarrhea is no respecter of anyone. So beyond just ensuring that you take these vaccines, you have to be careful of what goes into your mouth. We've said it before, wash everything, wash your hands, wash your fruits, wash your veggies. I don't think anybody this period should be eating from some kind of places. I'm not saying anybody should not buy their markets. But truth be told, if at all you must eat out, please ensure the stove is boiled 100 degrees. Not some kind of, can I think of that food that is prepared cold? I think the speaker one will be abacha. Abacha doesn't need fire, but it has a lot of mede that is made from things that flame. Supposedly fire will not burn the microbes. I hope you can hear me. Please, if you can hear me, just say hello. Let me know we are in this together. Hello, Laka, you're welcome. If you can hear me, please say hello. My network is quite unfriendly. And yeah, so I've talked about typhoid vaccine. I've talked about flu shots. I've talked about cholera vaccine, pneumococcal vaccine against pneumonia. And I've also talked about, which other one? Yeah, hepatitis A. So for those who think diarrhea is just for the children, please, let's debunk that kind of myth and embrace, embrace some kind of approach by being prepared, being preventive, and when you put your leg into the running flood, you come down with fungal infections. A lot of us, if you look at your nails, you see some kind of funny discoloration. These are the causes of all these things, and it takes a long while to treat. You could be on medication for a while and it weakens your immunity, you're unable to continue, or the medication does not even take its due course because there are certain medication that when you have a low immunity, it doesn't really take its due course, and you should be able to be healthy enough to ensure that the medication does its work perfectly the way it should be. Hi, UD, you're welcome. You're welcome, welcome, welcome. And then to chip it in, we have ringworms, and few of us have had to deal with some cases where the client will walk into the facility and just say it's just a skin lesion. But how do you handle them from the angle of being preventive? If you find out somebody has a skin lesions, find out what exactly it is. Because if it's measles, chickenpox, there are vaccines. We have different types of measles. We have the German measles and what we call normal measles. And then we have which is the rubella. So you want to ensure that Your vaccines are up to date. I know in Nigeria we don't do all those things, and a lot of times we feel like we have the immunity to handle a lot of things, right? But it's not always the case. Sometimes it's just the case of not having the funds to go for the treatment, or somebody not just speaking up. And trust me, if you speak up, there is always either an alternative treatment or what's the actual treatment. I want to end this life on this very note, that please, if you find a child in distress because maybe the child is asthmatic or child is shivering, don't try to just neglect or look away and say it does not concern you. Please pay attention. You could save that child from, let's not say what it is. But once children are exposed to cold, asthma is dangerous, it's an emergency. Either you quickly abet the situation for the child or you report the situation immediately to the nearest hospital. For those of us who cannot help but um, just sleep anyhow without the bed net, I understand that we have what we call long pants. Yes, you can use that and you're free to sleep. But then, what happens to your face? What happens to your hands? Please, the weather is cold enough for you to be well dressed and you can use your net to cover up. I also want us to end on this note. If you're up to a certain age, 30 and above, we are not even talking about 30. So now let me tell you the story and then I'll end it here. Of recent, I've seen a 16-year-old. Now I'm digressing from the raining conditions that are common during rainy season. Talking about something else now. Of recent, we've been seeing cases where people, I mean, adolescents 16, 15, 18, 19, 20 with raised blood pressure. And it's alarming. You know why? Because we have games, we have a lot of things that are occupying us whilst, I mean, when we're supposed to be sleeping, we are on the phone and we are doing a lot of back and forth. Hey, that's what also must pay. Hi, Auntie Niece, kids, you're welcome. So we are slowly going into the space where the age group that have that we are known to have raised blood pressure is no longer age 40 and above and whatever age. Now we are dealing with 16-year-olds. Yes. Why? Why are we having 16-year-olds with a raised blood pressure reading? And the truth is, these people on their phones playing games all night instead of resting their head or sleeping. And they come back all the time for pills. We are not ready to stop selling pills. But I'll be concerned as a nurse to ask you, why are you starting your life on pills at this age? So the idea is to check, to really be sure that you're not hypertensive or you're not doing anything differently as compared to what your parent did. Some of them had their diagnosis at, let's say 40, 45, later than that. Meanwhile, it's been building up and it resulted to a lot of things, which the complications are not friendly. So the idea is to ensure that you check your blood pressure at least every week, just in case you do not know. It's no longer luxury to have it in the hospital alone. Do you understand? There is a need to purchase one and keep it handy at home for the family use. And trust me, when it's for the family use, it will create that compliance. It will give you room to be more interested and you're obviously going to see that you're taking your life very seriously. Now, we have people who don't think that this information is important, but at the end of the day, it will affect because I've seen cases where the so called parents, which are supposed to be resting, are actually taking care of children, 16-year-old, that are on medication. That way, they excuse them from strenuous activities. Meanwhile, this child is supposed to be playing football somewhere. He or she should be doing some kind of activity. It's a productive age. So why are we leaving the routine medical checkup till things begin to play out? I'll take myself for example. I had to do my tests, run some tests, not just blood pressure, do other things. I had to check my liver, check my kidney, do a lot of urine tests. Yeah, those things don't cost money if you're interested. It's just a case of being serious about it. And then one came out that there's an issue somewhere. I did a lot. Now, it's my responsibility to take care of it with my doctor and with what I know. The truth is, when you don't know, you assume nothing is happening because a lot of times, certain cases like the raised blood pressure, you may not come down with symptoms when it's maybe around 150, 140 until it gets to the 180, 200. You now begin to have some symptoms like headaches. Please, a routine checkup is very important, even if you're not unable to do it every month, which is not even advisable. Quarterly or after 6 months, you have all those rundown tests done. And please, it's no longer luxury to not know your HIV status. So it's not a luxury that you don't know your HIV status, especially for those who are active. Because there are a lot of people that are being diagnosed, just their HIV is positive and they have their medications, they're living a healthy life. So that you don't say you're not aware that these things exist, please just walk into the lab and have those blood tests done. Hepatitis B is more crucial because your liver plays a major role when it comes to your overall well-being. The medications you take every day, they are metabolized and excreted and filtered from the liver. Your blood goes there, your glucose when you eat, and when you have a lot of fats to take, it gets stored in the liver. So when you don't take either your hepatitis B vaccines, now I'm talking to everyone, whether you're a child or an adult, and from birth, you're giving hepatitis B. So once you have your hepatitis B vaccine, it doesn't give you a giveaway to go and do anyhow. A lot of times, alcohol could also trigger that. A lot of times, people think it's a little bit of alcohol, but then you're also loading yourself with swallow. And what happens to the liver? So it's important to do a rundown test of your liver enzymes. You're also doing a test to check if it's infected. That way you can also do what? Start the treatment on time. There are medications for these things. You see children walk around with yellow eyes that jaundiced for a while and somebody's still looking at them without being concerned. I don't think it's a big deal to just go to the hospital even if you don't have the money, just for inquiry's sake. That way you can have the next you can take the next action. The liver conditions are more crucial, and if you're on this life and you know alcohol is your water in the morning, in the afternoon, in the night, when you just feel happy, you're taking alcohol. When you don't feel happy, when you're depressed, you're taking alcohol. Please, by all means, pay attention to your liver. That liver is going to give you a feedback of what you've been doing over the years. I hope this is helpful. Please send in your questions, send in your comments, and thank you for coming on this live. I want to get your feedbacks so that if there are questions, I can respond to them. So we also have vaccine for chickenpox. It's the 2 doses. You're supposed to take one, and then after a month, you have the next dose. You're also supposed to have your other vaccines. Pneumococcal vaccine, we have for adults, for children, depending on which of them you want, whether for your kids or for your elderly parents. And please, don't tell them that it's not necessary, because a lot of times they will want to discourage you. Just let them know you want them to have that. Sometimes it's because maybe Nigeria's weather is not so cold, And at the same time, a lot of them won't tell you what they're battling inwards. So let's pay attention to our elderly ones. Hepatitis B vaccine is common, it's easily available. Primary health care centers will always have it. So please go there, take your shots. And if you're really into alcohol, you have to take a good look. Open your eyes, look into your liver very well. And always rewatch, comment, ask your questions, and then of course my page is not free. Do well to follow, and yes, if you've learned anything from this life, please do well. Send me feedback. Okay. Alright, so we end on this note. Two things. Get your vaccines, control your water intake, and ensure you are doing your routine tests. Thank you and bye. Bye.